Namaste, I am Dr. Siri, infertility expert practicing in this field of infertility for more than 15 years, and I practice at Karuna Fertility and Maternity Center, Nagarbhavi, Bangalore. So one of the commonly asked questions is this, that whether these hormone injections affect the health of the woman or the lady. So these are hormone injections. Definitely we would be giving it in higher doses than the normal levels in the body in order to retrieve as many eggs as possible, so that there are sufficient number of embryos to try for pregnancy. And these hormones are washed away from the body in 2 to 3 days time, so they don't usually cause any permanent damage or health issues, and they can be safely, patients can undergo IVF for 3 to 4 cycles. And the long term effects, I would say, is since we are hyper stimulating the ovaries, there are high levels of hormones in the body which could later in her life can develop ovarian cancers and endometrial cancers. That is the reason we don't really advise them to go try many cycles of IVF. But there is a slight increase in the risk of developing these cancers. But otherwise, it doesn't cause any early menopause or any sort of hormonal imbalance in the lady. So, for many years we have followed conventional IVF methods, where we usually stimulate the ovaries with high dose of hormones for about 9 to 10 days, and once the criteria for egg pickup, the follicular sizes are matched, then we do an egg pickup and the further procedure of the IVF follows. Now there is a new thought process where a natural IVF or a minimal stimulation IVF has come into picture, where a normally producing egg, where a woman produces one single egg every month. So we harvest that single egg without any stimulation, or in minimal stimulation we give very low dose hormones or tablets just to retrieve about 3 to 5 eggs, and we pool the eggs or the embryos and then do a transfer later. So what are the advantages of doing a natural IVF or minimal stimulation is, it is seen that the quality of the eggs are much better compared to the conventional IVF. And the other advantages, definitely there is no hormones given in natural IVF, and in minimal stimulation there is only very mild medications that are given. So the injections the patient has to take, the cost of the injections also are reduced in natural and minimal stimulation. And the disadvantage with these natural or minimal stimulation is that we are getting only very few eggs, and we may have to repeat the procedure for several cycles, like maybe 3 to 4 or 5 cycles, depending upon how many of the embryos we have got in each of those cycles. So that is the disadvantage, that the patient has to visit the doctor and has to undergo multiple egg pickups in these procedures compared to the conventional IVF.